now I'm shining to make sure that the light is shining directly, checking for any strabismus, right? Okay, that's good. All right. Now look right here, okay? Doing cover test. Right here. Good. Now I want you to follow your eyes with my finger. I mean, follow my finger with your eyes, just your eyes, okay? Ooh. There's a little nystagmus there. She had a little tiny bit of nystagmus. Is there a little bit? Can you cover?
A cover?
Yeah, plastic cover.
Oh.
Okay, perfect. See, I don't have my equipment ready. You guys will have your equipment ready. That's on the list too to bring. Actually, can I have two clippers? I'll get some more out of the camera in a minute. Okay. Oh, and I need a tuning fork. Can you hear? What comes with your ears, right? Okay, now this is just an assessment. You don't have to do a history, okay? Okay, no problem. Open up your mouth for me. Say ah. Okay. Okay, a 10 bite. Well, okay, a 10 bite, I'm going to check your gag reflex. Okay? Then I'm going to look at your teeth. Okay, and at the same time, open your mouth really big. Good. Now you have to do this kind of with the lights, all right? It helps to have a drink of water for her. Have you swallow? Okay. You swallow her? Good. Thyroid. Okay. Can you say 99 for me? 99. Oh, this is tricky. I'm going to have you say E, okay? Say E. E. Good. E. Everybody. E. 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 99. 99. The only thing I didn't do was a Weber and the Ryan test, right? What else did I miss?
Maybe palpate, forces.
No, we're going to do that next time. We'll do that next time.
So do we have to do it for this one?
What's ever on the sheet?
Okay.
Let's see if I covered it. Gather equipment, which I didn't do. Prepare, observe appearance, assess vital signs, body measurements, that's the BMI and stuff. Test vision, level of consciousness, body movements, posture, speech, assess skin. Let's see. Inspect scapula, chest wall, use of exercise muscles, palpate chest, evaluate chest expansion, percuss, egophony, whisper, oscillation, E99, posterior chest, all fields, inspect chest, observe intercostal spaces, palpate anterior chest, percuss anterior chest, auscultate anterior chest, auscultate apex and left sternal border apart during exhalation, inspect and palpate for apical pulse, palpate apex, left sternal border, base of heart, auscultate over aortic point, tricuspid apex, head, note consistency, color hair, symmetry of facial expressions, client frown, closed eyes, raised eyebrows, tense sensation of forehead and cheeks, palpate temporal arteries, auscultate, palpate TMJ joint, visual function, inspect external eye, test papillary reflection of light, accommodation, assess EOMs, assess corneal light reflex, cover test, inspect the auricle of tragus and lobe ear, palpate auricle and mastoid process, use otoscope to inspect auditory canal, use otoscope to inspect tympanic membrane, hearing test Weber and Ryan, which I didn't do, inspect external nose, palpate external nose, check paints and airflow, use otoscope to inspect internal nose, transluminant maxillary sciences, inspect lips, teeth, gums, inspect hard and soft palate, uvula, assess for gag reflex, tonsils, palpate tongue, assess back tongue, assess strength of tongue, ROM neck, observe for goiter, palpate the nodes, preauricular, postauricular, occipital, tonsillar, mandibular, and sublental, palpate trachea, palpate thyroid, auscultate for thyroid buoys, and palpate and auscultate carotid arteries. Okay. So the only thing you need to do is the Weber and the Ryan and the gag reflex, right?
How do you test tongue strength?
You can just grab it, see if they pull away from you. Put your gloves on. But if they stick it out and then you don't see it, like, you can tell. If you're looking at it, they got strength in their tongue, right? If it's kind of floppy, like, bleh, then they're like, oh, there's something wrong with that tongue, right? So, but the Weber and Ryan, you know.
How do you do the gag?
You have to do the tongue blade. You want me to show you? Anybody get a tongue blade? Oh, well, that's...
Do you just like put it in the back until they gag, like just slowly put it back until
Some
they
people
gag?
have no gag reflex. So you might have somebody that does not have a gag reflex. Okay? You might have somebody that doesn't have one. I'm sorry. Okay? I hate tongue blades because it reminds me of like my teeth hurt. Okay? She doesn't have one. And she might not. Some people don't. My husband doesn't have one. I have a horrible gag reflex. Don't put anything in my mouth, it'll come out.
So like
Just tap it, yeah, tap it in the back.
of the tongue.
I have
really bad gag.
Yeah, I do too. Some people